Good morning, everyone, and welcome back to our 11th Annual Financial Executive Forum. And I want to thank everyone for joining us again today. This is the fourth event, our 2025 webinar series, and we really appreciate you joining us this morning. My name is Grant Palmer, and I'm a partner with Cordia Resources by Cherry Beckert, one of the sponsors for this series. As you'll see, we also have four other great sponsors who I'll introduce shortly. But first, I want to thank Jennifer Lewis and the AICPA's Business Learning Institute for the great Virginia Ethics program that they put on for us last Thursday morning. It was another informative and valuable presentation from Jennifer, so we're very appreciative of her and look forward to seeing her again next year. Our sponsors were excited to see such a great response. We have over 1,400 people registered for the series. We know and understand how valuable these high quality and relevant training events are to financial professionals managing corporate accounting and financial functions. Once again, we're providing this series in a fully virtual format and are running it in 2-hour sessions every Thursday morning over a 6-week period of time. We found that this format works best for our collective clients and friends. Today, we're joined by Allie Gregory and the team from Marsh McLennan, who'll be presenting Fiduciary Risk, Responsibility, and Opportunity, Implications for Health and Retirement. You should also know that we have a great team from Cherry Beckert running our virtual program today, but please bear with us should there be any technical issues. As you can see, we have 6 great programs in this year's series. If you fully attend all 6 events and you're a CPA, you can earn a total of 12 full CPE hours. As mentioned earlier, last week, Jennifer Lewis from the AICPA's Business Learning Institute led our Virginia Ethics program. The 2-hour course is required by the Virginia Board of Accountancy. Today, we have Marsh McLennan, a returning sponsor to the FEF, presenting Fiduciary Risk, Responsibility, and Opportunities, Implications for Health and Retirement. Next Thursday, the Wells Fargo banking team, a longtime friend and sponsor of the FEF, will present their economic update and Let's Get Digital, banking automation with APIs and embedded finance. And on November 6th, we have the final in our program. The Cordia Resources by Cherry Beckert team will feature our CFO Roundtable, which will once again include an impressive group of CFOs. So next slide, please. Before we move forward, just a few items around the CPR webinar rules. In terms of NASBA compliance, our polling questions will appear throughout the webinar. You'll need to answer 75% of the 8 polling questions to receive full CPE credit for each session. Any answer to a polling question, correct or incorrect, counts towards the 75%. Since you'll be muted during this entire session, please use the Q&A feature to submit your questions to the panelists. Please use the chat feature to communicate any technical issues that you may have. After the program, please complete the session survey using the link that we'll send to you in the post-event email. And your CPE certificates should be issued within 2 weeks of this course. If you have any questions, please reach out to Cherry Beckert Learning at cbhlearning@cbh.com. Now I'd like to acknowledge our great team of sponsors for this entire 2025 Financial Executive Forum series. Our first sponsor is Wells Fargo Bank. Wells Fargo, a well-known national bank, is represented by Executive Director Ben Kane. Wells Fargo Commercial Banking is a returning and longtime sponsor of the Financial Executive Forum. Our next sponsor is Cordia Resources by Cherry Beckert, a leader in recruiting and staffing services in accounting and finance, technology, HR, contracts, and administrative support services, and is represented by Doug Smith, one of our managing directors who leads our sales and staffing services team at Cordia Resources. Third is Sage, a leader in finance, AI, and automation with a financial management solution that has helped over 30,000 businesses achieve higher performance by providing the automation, connected insights, and trust and control needed to increase impact and drive real results. Sage is also a returning sponsor this year and is represented by Gary Mayer, Senior Channel Executive at Sage. Our fourth sponsor is Cherry Beckert, a top 25 nationally ranked accounting firm specializing in tax, audit, outsourced accounting, advisory, and system services, who is represented by Tracy Sheps, a CPA and a partner at Cherry Beckert. And our fifth and final sponsor is Marsh McLennan Agency, a leading provider of business insurance, employee health and benefits, retirement, and private client insurance to organizations and individuals. Marsh is a returning sponsor this year and is represented by Allie Gregory, Vice President in the Employee and Health Benefit Practice Area. And with that, I'd like to pass it over and welcome Allie and have her touch on the agenda and take off on the presentation. Allie?
All right, great. Thanks, Grant. Well, we are excited to be here today. I'm accompanied by my colleagues, so you have a number of us on. We brought you a group of subject matter experts to share in their, expertise with fiduciary risk in terms of health and retirement. So after our kickoff, we are going to do a few introductions of our team, and then we will dive into employee health and benefits. Following that, at 9 o'clock, we will take a 5-minute break. So grab some coffee, get some breakfast, come on back, check your email, and we will start retirement at 9:05. At 9:55, Grant will close us out. So thanks for joining us today. We can dive into our introductions of our team. So I am Allie Gregory, as Grant mentioned. I am a consultant with our employee health and benefits practice. I am joined by Ann Hensley. She is a senior vice president. She is our national ERISA and compliance practice leader and brings almost 2 decades of experience to her work. So we are excited to hear from her this morning. She is joined with Stephanie Rayborn, who is also a senior vice president, and she is our senior employee health and benefits compliance officer. She has been a compliance officer for 4 years, and she will be sharing her knowledge with us today. Rick Kelly is joining us as well. He is our national pharmacy practice leader. Rick is a certified actuary. He is a member of the Society of Fellow Actuaries. He works with clients all over the country and really dives into the complexities of our pharmacy practice and sort of all of those things that are going on today, which you are hearing in the news because pharmacy is hot. Rick will be talking about those. And finally, we have Gerald Escobar on our panel. Gerald is a consultant in our employee health and benefits practice. He works with clients all over the country, just like you. And he will be diving into some things around total rewards, the landscape that we have today. And he will be closing us out with some thoughts to think of as you go back to your teams. Jim, would you like to introduce our retirement team next?
Sure. Thanks, Allie. Yeah, welcome everyone. And my name is Jim Morris. I'm a vice president and institutional retirement plan consultant here in our DC market. We're excited to be with you today. And we'll handle the second half of the presentation after the break. Joining me too on our team is Jake Connors, who is with our office down in the Raleigh area, as well as a retirement plan consultant, and Kathleen Kelly, who's our managing partner of the retirement practice here in the Mid-Atlantic. So we look forward to diving into the retirement piece in the second half of the presentation.
Great. Thanks, Jim. All right, we're going to get our presentation up for the benefits team and we will get started. Fabulous. Thank you. So you see our benefits team here. They will do some brief introductions as they start to answer those questions that we have for our session today. I'd like to start us off and turn us to Ann. Ann brings really a strong background in the compliance practice. She has worked at law firms. She's been on the corporate side as well. And so she is going to give us a little bit of an understanding of the landscape right now of fiduciary responsibility for company health benefit plans. And can you just introduce yourself and tell us a little bit about that landscape?
Sure. So, hi everyone. It's nice to be here virtually with you all. Good morning. There's nothing like starting off strong with compliance early in the morning. Everyone loves that. But there's a lot going on. As Ali said, I am the compliance practice leader for MMA. So my job is to kind of keep abreast, along with Stephanie and my team, of what's going on in the health and welfare benefits compliance space for our clients and help keep our clients out of trouble, stay away from penalties. And really the only constant in our world right now is change, right? So significant things coming out. I know Rick is going to talk later about what's going on probably in the pharmacy world with litigation. But right now, it's all about transparency, the rising cost of healthcare, and how, particularly for you all, how to manage your plan, keep those operating costs low while maintaining compliance. And there certainly is a lot out there to keep up with, but transparency is at the top of our mind, and managing those healthcare costs is certainly at the top of our mind as well. So when we talk about that, I'm going to go right in, Allie, if that's okay. Would you like me to go right into the
Absolutely, yeah.
fiduciary to number one, our question one? when we're talking about maintaining our plan and compliance and making sure that we kind of keep those costs in control, um, one of the basic, things that we can talk about is how to identify fiduciary responsibilities under ERISA, what those responsibilities are, and then how we can meet those obligations as plan sponsors, right? Because that will help us maintain compliance, which is a big part of fiduciary responsibility. And that will also, in the end, help us control plan costs, right? So, what is a fiduciary responsibility? Who is a fiduciary under ERISA? And what are the fiduciary responsibilities? That's a good starting point before Stephanie kind of gets more in the weeds with this. But ERISA really sets the minimum standards as to who is a fiduciary and what those fiduciary responsibilities are. So, ERISA's reach, just as a reminder, is not limited to retirement programs. We focus on health and welfare programs, not on the retirement side. So most employer-sponsored benefits are going to actually be subject to ERISA unless an exemption applies there. But a fiduciary at the most basic of levels is one who exercises discretionary authority or control over a plan's administration or assets. ERISA does require that health plans do include a named fiduciary who serves as plan administrator, but importantly, and so that plan administrator, before I go on, is going to be by default a fiduciary for the purposes of ERISA. But ERISA not only requires someone to be named in the plan, we've got to go back to that definition. Who actually exercises control over the plan or the plan assets? So if there isn't a named fiduciary, we've got to look at who has control. What are the activities that have control over those and decision-making authorities, for example, over a plan? This all arises out of the concept that ERISA is really there to protect the interests of employees who participate in the health and welfare benefit plans. So you can see here that the responsibilities of a fiduciary, once that fiduciary has been identified, not just what's written down, but who actually in practice exercises control over the plan and has decision-making authority over a plan. Those duties of loyalty are actually on the screen there. And I think just for the sake of making sure we have the details right, I'll read those out loud. So duty of loyalty must act for the exclusive purpose of providing benefits to participants and their beneficiaries, paying reasonable expenses of plan administration, not making false or misleading statements or misleading by omission. The duty of prudence is that means acting with care, skill, prudence, and diligence of a prudent person in similar circumstances. You have the expertise to manage the plan or hire or monitor someone who does. And Stephanie and I will get into that in a little bit. Duty of diversification doesn't apply so much in the health and welfare space. That's really on the retirement side, but diversify plan investments to minimize risk of large losses. So again, that primarily applies to those retirement plans, but can apply in the health and welfare space for those benefit plans with trusts. And then establish, maintain, to act in accordance with those plan documents, very big one that we deal with on a regular basis. And that is establishing, maintaining, I'm going to click out of that comment, establishing, maintaining, administering the plan in accordance with written terms, so long as those terms are not inconsistent with ERISA. So those duties are very much distilled down for the sake of the presentation, because really we could spend, not that we would want to necessarily, but 8 hours on the fiduciary duties under ERISA and how to identify the fiduciaries and then going into greater detail there. But the duty of loyalty and the exclusive benefit rule at the top of those responsibilities there on the screen can really be summarized to require that fiduciaries, once identified, they act only in the interests of the plan participants and the beneficiaries, and that plan assets are used to pay for the plan, those plan expenses. So, for example, a plan sponsor could not use employees' benefit payments, right, their premium payments, to pay for the employer's general operating expenses. That's a really good example there. And then the requirement finally to follow the plan document. I said Stephanie and I are really, we really see questions on that almost every day. We need to have a plan document. We need to follow those terms of the plan document because participants need to be able to accurately ascertain what benefits they have available to them, including limitations on those benefits. And so the plan documents are the instruments that are going to really inform participants and beneficiaries of their rights and responsibilities under the plan. There's a great deal of litigation on both of those points. So very important there. And then finally, the duty to act prudently at its highest level requires that fiduciaries do act with that care, skill, prudence, and diligence under the circumstances. So that means, how are we making decisions? What's our decision-making process? Who are the vendors that we are identifying and hiring to help us run our plan? So we'll get into those a little bit as Stephanie and I kind of go through the next questions, but that's at the basic level what a fiduciary is and what those responsibilities are for fiduciaries.
Thank you, Anne. Let's turn to Stephanie now. Stephanie, so now that we understand a bit more about the responsibility, how can plan sponsors protect themselves from a breach claim allegation?
Thanks, Allie, and good morning, everyone. Yes, as Anne mentioned, the first step is understanding who a fiduciary is. You can't protect against when you don't know what your responsibilities are and who might be on the hook, right? As Anne mentioned, plans must have a named fiduciary. Look to the plan documents first, of course, to discover, to see who that named fiduciary is. And also keep in mind that this, who a fiduciary is also a functional definition. So that meaning who is exercising discretion or control over the plan or its assets. So you can have a functional fiduciary even if you aren't named as one. But again, every plan under ERISA is responsible for having a named fiduciary in those plan documents. Also, abiding by those responsibilities that Anne discussed, loyalty, prudence, acting in accordance with plan documents, and document doing these things. Excuse me. The standard is not doing things perfectly. It is being able to document having a prudent process. Also monitoring vendors' performance. So writing a check if you're insured with, say, Blue Cross Blue Shield or United Healthcare, even a small 20 life company that is fully insured with Blue Cross or United Healthcare, there is still a fiduciary under ERISA. Writing a check and is not going to work as far as being able to pass off your responsibility as a fiduciary. And a key point here is while plan sponsors, fiduciaries can't necessarily prevent participants or plaintiffs' firms from making claims, maybe we wish that they could, they can operate in a way that makes being challenged less likely and a successful defense more so. So again, abiding by these plan terms as required by ERISA. Also working with trusted advisors and good service providers. There's no standard under ERISA for selecting the lowest cost option, although we are seeing some of these allegations essentially indicating so, which is part of where that importance of documenting your decision-making processes comes into play and is valuable. And also understand the fees that you're paying, the fees that you're paying to your third-party administrator, to pharmacy benefit managers, as we mentioned, pharmacy being a huge source of litigation and consternation over these prices. Understanding the fees that you're paying to your broker. So all of these things can help plan sponsors protect themselves from these breach allegations. So know who a fiduciary is, look to those plan documents, and make sure your fiduciaries understand what their responsibilities are.
Thank you, Stephanie. Let's go ahead to our first poll question. I know everyone is eager for that. All right. I know that as a host, we don't get to put our poll in, but I think that time for that poll is ending soon. So make sure you do respond. The answer to our poll question of who is considered a fiduciary in the context of employee health and benefits plans is B, a person or entity that acts in the best interest of plan participants, making prudent decisions and avoiding conflicts of interest. One thing that I think Stephanie really brought to light, there we are, is that regardless of your funding model, whether you are in a fully insured plan or you are a much larger organization and you are in a self-funded plan, that you do have fiduciary responsibility. And I think that that was a fabulous thing to call out there, Stephanie, for everyone. All right, we want to move towards our third question for Stephanie and Anne, which is how can plan sponsors or can plan sponsors align with the plan designate someone as a fiduciary to shift the risk?
So I'll start with that. Stephanie, do you want to jump in? We can kind of,
Yeah, I'll just
yeah.
jump in.
Sure, absolutely. So this is a question that we have received very frequently lately because of the recent legislation and the impacts on plan sponsors for those compliance obligations that require transparency and also recent litigation over fiduciary issues. So we're asked about this a lot, and unfortunately, the answer is kind of a yes and no, right? You can perhaps shift some risk to a willing participant in terms of like a vendor, right? You can outsource claims administration, you can outsource some compliance obligations and review processes or procedures. But there's really no get out of jail free card for ERISA fiduciaries and plan sponsors, right? So the plan has to have a named fiduciary. It can be a person, a title, a group of people, and that has to be identified in the written plan. And again, that fiduciary can engage with an outside vendor, and that vendor, if willing, can accept some of the responsibility, but there is no such thing as just absolutely absolving oneself of the fiduciary risk and responsibility here. That does remain and will remain with the plan sponsor, right? Think about what ERISA was enacted to protect. It's to protect the interests of the employees and their benefits and their investments and all of that. So we are here to protect those employees, and the plan sponsor is in charge of that. The plan sponsor is subject to ERISA and cannot entirely shift that responsibility off to someone else. So writing a check to the vendor, remitting the premiums, we don't absolve ourselves as plan sponsors of those fiduciary duties. So they remain responsible for prudently selecting, as we just went through in that first question, selecting and monitoring those they hire to ensure compliant administration of their benefit plans, make sure the expenses are reasonable, and make sure that all actions that are taken are serving the participants, that they are in the best interest of those participants.
Thank you, Anne. Stephanie, to wrap us up, what are some things that the financial executives who are on today should take back to their teams from a compliance perspective?
Oh, there are so many, but I can distill it down to a few, a few for us this morning. As far as recommendations on how to consider these responsibilities, first off, as we mentioned, identifying and training fiduciaries on what it means to be a fiduciary of the plan, especially understanding that health and welfare benefits are complicated. The expectation from an ERISA perspective is that fiduciaries act in the best interest of participants, avoiding engaging in self-dealing. So you always want to think about when you're making these decisions and you're documenting them. Think about that overarching goal of ERISA in protecting the plan and protecting participants. So when you're acting as a fiduciary, that is your North Star. Follow the law. Ensure you're properly filing things like Form 5500s, providing plan documents to participants, not making exceptions that violate the terms of that plan document. I'd also consider hiring an independent third party, such as employee benefits counsel, to review plan documents and ensure that they're accurate and being operated according to their terms, right? Having someone, having an independent third party who's going to, look at your baby with a little more scrutiny than maybe you would. And then I would consider fiduciary liability insurance as an extra. There's, of course, as Ann mentioned, no writing a check and no declaring to the DOL that it's someone else's plan responsibility, such as your insurer or your broker. But considering that extra insurance as well to protect against inadvertent violations, things of that nature.
Fabulous. Thank you, Stephanie. And anything to add there?
Yeah, I just want to reiterate some of the things that we've mentioned and Stephanie eloquently stated, but I think we have to also remember the outcome of a plan decision isn't necessarily what is going to drive this. Stephanie mentioned the processes and procedures. That's really important, right? So we've got to give good consideration to the processes and procedures of running a plan. Make sure that we're really monitoring our service providers. Who are we engaging with for vendors to help run our plan? It doesn't have to be the least expensive. We just need to prove that we were thoughtful in our approach and doing everything. Our actions need to be reflecting the best interests of the participants of our plan. The outcome isn't necessarily as important as the processes and procedures used by plan fiduciaries to make decisions and make sure that their vendors are acting in accordance. And that's why we talk about the plan documents too. We've got to make sure we have a plan document and we've got to make sure that we're following the plan document to a T. So our actions are really, really important. Sometimes the outcome isn't as important as what we do that leads up to that outcome.
Great. Thank you, Anne. We are going to go to our second poll question. So please make sure you participate. There we are. So great answers. B is the correct answer. So it is important for a fiduciary to consider and to ensure plan costs are reasonable, monitor the vendor performance, avoid conflicts of interest, and always act in the best interest of the plan participant. So thank you, Stephanie and Anne. We are going to turn now to Rick. I said when I introduced Rick that pharmacy is hot. It's been in the news, but Rick, really to get us started, one thing about pharmacy that always, comes up in meetings with clients is, why is it so hard to really understand it? It seems like we don't really have clear transparency what's going on with pharmacy. Can you tell us a little bit about what's happening today and maybe even predict what's going to happen into the future as you know it?
Sure. Well, good morning, everyone. Again, Rick Kelly. Glad to be here. So first off, I'm not going to pretend that I can predict the future of pharmacy. I don't know anyone who can do that, but we'll offer some thoughts about that. I think pharmacy is hot, right? There are literally hundreds of bills on a state and federal level in terms of discussion around pharmacy and PBMs, and I think Ann and Stephanie did a really nice job, obviously, of outlining what it means to be a fiduciary. And I think as we work with employers, a lot of the fiduciary risk has come from pharmacy, or at least a lot of the lawsuits have come because of a perceived misalignment as it relates to pharmacy. And I think that there's a couple of things that are driving that. We'll start with this slide. One, of course, is the cost pressure. So if you look at this slide, it shows the basically change or trend as it relates to pharmacy over the last 15 years and where we think we're going for the next 5. We'll update this slide at the end of this year and look a little bit out. So maybe a little bit of a prediction, if you will. But if you look at this, right, in the last 10 years, pharmacy costs have more than doubled. And that's the bad news. I think the worst news is they are probably going to double again in the next 5 or 6 years. And when you think about the purple line, which is the specialty medications, you think about the green line, which is the brand medications, tremendous pressure in terms of what's happening there, right? There's the pipeline that the pharmaceutical companies and the biotech companies are working on really are focused on specialty medications. And from a patient perspective, a lot of these medications actually do incredible things. They really do help people. They really affect the quality of life, if not even the ability to live. But they put obviously tremendous pressure on an employer perspective. And because of that, right? As you think about specialty meds, you think about GLP-1s, you think about price inflation, all of our audience is living this in terms of the organizations they're part of. Employers are obviously looking to continue to handle most of the cost burden, but because of the reality of the pricing trend and the cost trend, they are asking employees to pay more. And whether that means benefit plan or whether that means paycheck contributions. And so I do think the cost pressure is obviously bringing a lot of focus. We're going to talk about misalignment in a minute, which I think is also bringing a ton of focus. I think also just kind of maybe another comment or two on the industry. The big pharma companies spend more on advertising than they do on research and development now. And so when you look at what's really happening in terms of drug development, most of that is happening on the biotech side. So I live in Raleigh, right, one of the biotech hubs in the country. As things look promising, a big pharma company will actually buy the biotech company developing a drug, take it to completion, then throw it through its sales force and actually price it at a very high level. So again, the bad news is cost is really, really challenging. The worst news is I think it's going to maybe even accelerate in terms of the trend and the cost pressure that people are seeing. And so if we go to the next slide, and this one will hit quickly.
Sorry, Rick, if we just want to pause for a second, you have a few questions.
Oh, yeah,
In
please.
the chat. So let me read one. This member who's asking the first question is saying there's certain medications that cost upwards of $400 per month, while the drug company spends millions of dollars in TV ads. Is there any relief in sight?
So the answer is maybe, which I know is a very unsatisfying answer. But, the US is only one of two countries that allows pharmaceutical companies to actually advertise medications in the way they do. And I think there is some momentum questioning whether that should actually be allowed and should that change, number one. I think number two, the pharma companies, though, right, as long as they are able to, they are going to use that advertising because it works. We work with a lot of healthcare systems, a lot of physician groups, and they will tell you that people will come into their office demanding a certain drug by name for a condition that the patient thinks they have. And many times, if the doctor doesn't think it's warranted, the patient will actually move their business. And so it does work. But I would say I'm optimistic, but I wouldn't bet my house on that.
Rick, second question. We hear drugs are cheaper abroad. Are the increases corporate greed or legitimate costs here in the United States?
So many drugs are cheaper in other countries. There is some momentum around, or questions, there's momentum around the conversation of, can employers be looking to import medications for their employee health plan? That is a whole deep discussion that if we ever have it, we will have Anne and Stephanie as part of it, but there is a lot of questions around that. I think that if you are a publicly traded company, it is important that you are delivering value to your shareholders, and that's what's happening on the pharmaceutical side. I think that our country historically has not had the government negotiating with pharmaceutical companies, even on things like Medicare and Medicaid. That obviously started to change under the Biden administration. It appears that it is accelerating under the Trump administration. Right, there's been a lot that has happened over the last couple of years. There's been a lot that's happened over the last couple of weeks as it relates to certain things like tariffs, which are really focused on brand medications. Pharmaceutical companies that are doing manufacturing within the US may be exempt from those, that they are focused on brand drugs. You look at the most favored nation announcements that have come out initially from Pfizer as the first company. Again, those appear, we're still trying to digest all that and really parse through it. Those appears to be really focused on Medicare and Medicaid. You look at some of the direct-to-consumer and cash plans, even what was announced as Trump RX. which again, today appears to be focused on non-insured medications or people who do not have coverage. So I think there is drug companies, again, do spend a lot of money in terms of biotech acquisitions and in terms of R&D. I think it's reasonable that they try to cover their costs and be able to obviously make a profit. I think a lot of people, though, would agree that as a country, we are probably paying more than our fair share of their profits.
All right, thank you, Rick. All right, let's move to the next slide.
Yeah, so we'll move to the next one, and this one we'll hit just quickly. So we're not going to go through the slides so everyone can breathe easy, but this actually is showing the typical supply chain of a brand name drug. And really the key here is you can see how complicated it is. You can see how many parties actually have their hand in it. Every party needs to make some money. And I think maybe the overarching comment here would be that when you use a word like transparency, that word means something totally different in the pharmacy benefit manager and the pharma company world than it does to all of us on the phone. And that is one of the real challenges of managing the cost of pharmacy, is because it is so complicated, it is so opaque, it is so hard to understand what really is the cost and how many people are adding on top of it as a way to try to navigate. We can go over to the next slide, the last one, and talk again. So, right, we're talking about employer fiduciary responsibility, and you see some of the lawsuits that have been made public in terms of violating that fiduciary responsibility relating to pharmacy. And so I mentioned one reason is the cost. The other reason is I think it's become fairly common knowledge that the pharmacy benefit managers, PBMs, are misaligned as it relates to actually working with employers to manage to lowest net cost or to manage to handling pharmacy well. You know, we say a lot of times, you would think a pharmacy benefit manager would be in the business of managing pharmacy benefits, but that's not what they do, and that's not who they are. And so I'll give you just a few examples in terms of how this slide talks about they're not incented to provide these types of things. So number one, the PBMs develop the formularies or the preferred drug lists. And many times, if you're not providing the right oversight of that as an employer or partnering with someone, there will be drugs on those formularies that really don't add value. And if you actually talk to the PBM, some of them will even call them worthless drugs. And I'll give you a couple of examples super quick. So one is a drug like Duexis. Duexis is an over-the-counter Advil and an over-the-counter Pepcid AC smashed together. That's all it is. It costs $2,600 a month. And you might sit there and say, why would a PBM have that type of a drug on the formulary when someone can just get over-the-counter Advil and Pepcid for a total of like $20 for the entire month? And the reason is the PBM gets paid by the pharma manufacturer every time that drug is filled. And in the example of Duexis, that payment is fairly high. Therefore, the PBM will actually add that drug to the formulary. I'll give you one other example, a drug called Jublia. It's for toe fungus. You have to put it on your toenails twice a day, every day for 6 months, which, first of all, the chance of that happening is very low. But if you do it, it is only 25 or 30% effective after the 6 months. Again, this drug is over $1,000 a month. The drug is on the formulary because of how the PBM makes money. So there's a lot of opportunity to make the formularies more efficient and effective if you understand that. A couple other examples. When the PBMs do the prior authorization and the utilization management, unfortunately, they have a double conflict of interest. Most of the PBMs own their own specialty pharmacy. So when they approve a specialty pharmacy medication, they actually make money twice. They make money by the spread because they charge the employer more than it costs for them to actually fill the medication. And then they make money because they also get payment from the pharma manufacturer. And so, not surprisingly, we see that the approval of medications from the PBMs are at a higher level than we would see if we were using an independent third-party clinical organization. And then the last example I'll give real quick is the PBM contracts themselves. A lot of times the PBM contracts have wording that sounds either innocent or common sense, or even worse, to your benefit, that actually allows them to gut the financial integrity of the deal you think you've negotiated. And I'll give you a really quick example. So a lot of times the definitions are very complicated. So a generic drug may be defined as a medication that is a generic, quote unquote, but then we'll have caveats around things like any medication that is manufactured by less than 3 manufacturers is considered a drug in short supply and therefore gets priced as a short supply drug. And if you don't understand what that means, it means that you're going to pay brand pricing for a generic drug. And so we have a lot of financial people on the call. So just to really boil it down, it means you're going to pay 300 to 400% more than you should be. And if you don't understand the intricacies of those definitions, you end up paying a lot more. And it's because of all of that misalignment. You think about the article from the New York Times, you think about the investigative series from the Wall Street Journal, you think about the report from the Federal Trade Commission, all of this is known. And so what's happening is employers have risk to where the trial lawyers are actually filing lawsuits saying, we've been able to find examples where we believe an employer is not being a good fiduciary because we are finding egregious pricing on medications or egregious cost on the pharmacy plan, that if there was the proper oversight, those types of costs could actually be managed out, and it would lower the overall cost to the employee, whether that's through cost share through benefit design or whether that's through payroll, right? Whether that's fair or not, that's a different question. And so I think to maybe wrap up, so how as an employer, what do you do? It's really critical that you think about that slide we had before, how complicated everything is. It's really critical as an employer that you are working with a partner that has 2 things. The first is the expertise to actually understand all this. And the second is they actually have the size and the scale and the leverage to actually change the way the pharmacy benefit managers treat you and interact. So with that, Allie, I'll turn it back to you.
Okay, great. Rick, I know we won't be able to get to all the questions, but there are more questions for you in the chat as well as the Q&A box. So just want to make sure we draw your attention there, maybe to answer some questions as we move on to Gerald. But I believe we do we have a polling question next, Gerald, I believe? All right, great. So polling question number 3. All right, great. So C is the correct answer. So why are pharmacy trends such as medication costs and usage rising in recent years? It is C. It is the increased use of specialty medications, including GLP-1 drugs, and the rising prices of prescription drugs. All right, thank you so much, Rick. We are going to move on now to Gerald. Gerald, thank you for joining us. Again, Gerald is a consultant, works with a variety of clients similar to you all. Gerald, before we dive into the fiduciary risk, and we know that a lot of our clients and participants have plans that renew January 1st or are renewing this Q4. Can you give us a little bit of a landscape of the experience right now across the employee health and benefits landscape?
Sure. Thank you, Allie. Good morning, everyone. So I think in terms of looking at this through the conversation we've had with Ann and Stephanie and Rick, there is a heightened awareness in terms of what is happening, particularly right now with over 70% of employers across the United States who offer healthcare to their employees and are renewing for January 1st. Many of you are in the audience today, maybe going through that exercise right now. There is a convergence of pressure that is being created by several different ingredients that is causing this need for us to not only look at what we can do best for our members, but through the lens of fiduciary risk, what can we proactively do moving forward? And as Ann mentioned, from a fiduciary standpoint, it's not a one and done exercise. It's an ongoing proactive management of how you do that to limit your risk. I want to share with you that when we talk about rising costs, I think in 2026, we are going to see the highest increase that we've seen nationally, on average, approximately 9% to 10% increase on the healthcare expenses. If you read the Wall Street Journal yesterday morning, there was an article about rising costs on health insurance, and the average family health premium in 2026 is approximately $27,000. So since we've left COVID, there's a few things that I want to mention that are continuing to apply pressure. One is that the inflationary pressure between payers and providers, so the negotiation and renegotiation of contracts between facilities and providers, continues to be a cycle that is fraught with rising costs and reimbursements that trickle down to employer-sponsored healthcare. We've talked a little bit in terms of not only the pharmacy costs and the impact of that with the introduction of specialty drugs, but also just overall high cost claimants. So there's been a spike in increase of things such as cancers within a population of an employer, and the treatments required to serve those members have continued to escalate. There's also been the introduction of, just when you think about tariffs and you think about pharmaceutical drugs, there's the introduction of uncertainty of what's going to happen. So a lot of these things combined with, as you know, right now, the government is currently facing a conversation whether they should continue to provide premium tax subsidies for those who may be on the exchange plans in the marketplace. And until that may be solved, many of the payers, so think of the insurance companies, are determining whether they may be inheriting additional risk in the future, or members may be jumping on their employer health sponsored plan. So a lot of those things are converging on what are creating what we see today as above average renewal increases. We also have talked about transparency. So coming out of the Consolidated Appropriations Act, it's not just transparency with the providers and the payers, but also the advisors, consultants, and brokers that consultants work with. And so as we think about this and looking forward and what leaders within an employer's leadership team and looking with financial executives and HR professionals, making sure that you don't have any mismanagement or misalignment in those whom you are working with. I'll share with you that in 2024, there was about 730 civil investigations closed by the Department of Labor that led to about 1.5 billion in recoveries directed to employee benefit plans, participants, and to beneficiaries. So this is on the radar. You're beginning to see more people who are maybe frustrated as a member. As Rick mentioned, I want to get a brand drug and I can't. I need to get a treatment and it's not authorized. What can I do? And that frustration is leading to people asking questions in terms of what is being offered to me by my employer around my health plan, and is it properly managed? And at the end of the day, this may lead to, high-level investigations, but most importantly, in terms of a plan sponsor, is avoiding any penalties, making sure that there's the avoidance of any personal liability where possible, and also just reputation management for your organization to be an employer of choice. We do have one poll question before we wrap up, Allie.
All right, great. Poll question number 4 is now up. So question number 4, what is causing the increased risk around plan fiduciaries and employee health and benefits? The answer is D, rising medical and prescription drug costs, a new federal transparency regulations, increased lawsuits, and greater enforcement by regulators. All right, Gerald, I know that you have one more slide you want to cover as we start to transition towards the end of our time. I know we still have questions coming in, so Stephanie and Ann and Rick, thank you for monitoring and getting back to folks. We really enjoy the active participation. So Gerald, what should a plan sponsor be asking their consultant? What are the things these financial executives should be taking back to their team?
Yeah, what we're seeing is oftentimes we're hearing that folks are considering implementing a process. So they're thinking about it, or they've already taken steps to start it. But in many surveys conducted, whether it be by consulting firms or industry third parties, The reality is that 3 to 5% are actually conducting any form of regular committee meetings. So there's an opportunity here to be able to protect yourselves through what we've talked about today. If you look at the exhibit on the slide through recent study for 2026, there's different actions that our employers are looking to take. And if you look on the left-hand side, really at the first three, where the majority of the respondents are focusing on some of the things like Ann and Stephanie addressed, and that is ensuring from a documentation standpoint that you are up to date. And that is something that you should be working in conjunction with your consulting partner on your employer-sponsored health benefits. But it's really in terms of stressing the need to be proactive and not reactive when something may be coming up by a member of your plan or by a third party who's been an inquiry into your plan. That documentation can be voluminous, so you want to make sure that you have good record keeping. The other is also in terms of costs and benchmarks, which you'll see is the third one. And this is a big area where we are seeing employers wanting to understand how they are paying for services, whether it be through third-party administrators. For those who may be in more of a self-funded arrangement, they are really getting the data to be able to dig in deep and decide, are we actually paying fair and reasonable costs, not only as a plan sponsor, but also, as we talked about earlier, as a representative of the members of your health plan, are they also paying fair and reasonable costs as well? The biggest thing that we'll see right now, and I go back to Rick's conversation, is that pharmacy is probably one of the lowest hanging fruits due to the lack of transparency. But at the end of the day, it's a matter of doing the right due diligence. And another area that we're seeing that when we talk about due diligence is there's a lot of employers in the organizations that are going through various exercises for their business objectives. They may be raising capital. They may be going public. They may be involved in some form of merger and acquisition. Those are areas where, when we think about fiduciary risk on the employer-sponsored health plans, is another area where you're going to want to have things buttoned up before any of those activities take place. So I think at the end of the day, there's an opportunity for those here attending our session this morning and the subsequent session, which will pertain to welfare and retirement, that this isn't going away. It's not only in terms of making sure from a financial concern you're managing the plan, but as Ann and Stephanie also mentioned, an obligation under ERISA that we're doing the proper due diligence and prudence as a plan sponsor.
All right,
That wraps up our session for this morning.
thank
Gerald,
you.
I'll just jump in and answer one really great question that was posed.
Sure.
Someone asked, are we upholding our fiduciary responsibilities as employers when we have no control or oversight of the PBM being used or the formulary if we're on a fully insured plan that determines and establishes that PBM relationship? Excellent question. I don't know that there is a clear answer. I could tell you what plaintiffs' firms might want to say. On the one hand, there may be less risk if you're especially a smaller company. There may be less risk because of that lack of ability or to control or oversee. But as Gerald has done an excellent job of pointing out, being able to document your decision making and process, and maybe, for example, if your company's large enough to potentially go fully insured, maybe you look at that and decide that's not a great fit for reasons. Being able to have document that you've taken those proactive steps to think about what is best for your plan, I think goes a long way. On the other hand, if it's a super large company and there hasn't been that effort, I think that is potentially more likely to get challenged. Bigger companies are going to have more attention paid to them as far as what they're doing, right? So, I don't think it's clear at this point, but I think to Ann's point about being able to document your processes and your decision making, it's not perfection that's expected; it's prudence. So, great question.
Thank you, Stephanie. Ann and Rick, as we close, any final thoughts that you want to leave the group with us today?
Rick, do you want me to? I'll go first.
Sure.
I think everyone's done a wonderful job of laying this out, and I think my final thought is there's so much out there to contend with from Stephanie's perspective and my perspective. And with the increase in litigation and the rising healthcare costs, paying attention to compliance and paying attention to fiduciary duties and making sure that we have, for example, what's on the screen right now is an excellent kind of roadmap, and our slides are an excellent roadmap and place to start. But paying attention to that, I think, can go a very long way in helping manage the plan and managing the plan costs.
Great,
Yeah,
thanks, Ann.
thanks. Yeah, thanks, Ann. And just one comment to add, I think that's spot on. And, when it comes to something like pharmacy, which is super complicated, sometimes it's easy to get overwhelmed and say, okay, I think we've got a good deal. I think it's really important to really get into the details with the right partner to make sure you're not just protecting your fiduciary responsibility, but you really, really are managing your capital well.
Thanks, Rick. So just to simplify a few things, name your fiduciary, make sure you have plan documents, document your process, and pick a strong partner. So thanks for joining into the employee health and benefits part. We are excited to have our retirement team on after the break. So tune back in, stay engaged, keep asking questions. And Grant, I'll let you take us into break.
Yeah, no, that's excellent. What an excellent presentation. Very informative, and just love the interaction, the questions. Obviously, it's a hot topic with the attendees this morning. So let's go ahead and take a 5-minute break, and we will reconvene approximately 9:05, if not a little bit earlier. So get a cup of coffee, and we'll see you in 5 minutes. Great presentation again, Allie and team. First half was really interesting. And then we're going to move on to the retirement portion of the Marsh McLennan presentation today. And so I'm going to pass it over to Jake Connor, Senior Director, Institutional Retirement Plan Consulting. Jake.
Thanks, Grant, and good morning, everybody. Appreciate you spending some time with us. Let me start sharing my screen and we can jump right in. Okay. So as mentioned, my name's Jake Connors. I'm a leader in our retirement services team here at Marsh McLennan Agency, and along with my colleagues, Kathleen and Jim, we're going to be talking with you today about some of the risks you might be exposed to as fiduciaries overseeing your corporate retirement plan. We're actually going to jump right in, though, with a poll question. And while Allie and her team on the employee benefits side offered their polling questions as more of a test, ours are more trying to understand how y'all are approaching some of the risks that we're going to talk about. And so the very first polling question you can see on your screen: have you been the subject of a Department of Labor or IRS audit, or the target of a fiduciary breach lawsuit for your 401k plan? So we're interested to hear from those on the call whether they have been exposed to any of the risks that we're going to talk more about here over the next 45 minutes. So we'll give just a minute for folks to answer that and get some ideas of how much exposure y'all have had to some of the areas that we'll be discussing. Right, so we do have a handful on here who have been the subject of some of these issues. Thankfully, a majority haven't yet. We hope to keep it that way for you, but where we're going to spend some time today is talking about what these risks are and kind of how you can protect yourself. Now, most of the fiduciary breach lawsuits that we've seen around retirement plans have targeted the very largest organizations. About half of 401k plans with over $1 billion in assets have been sued just in the past decade. But a relatively recent Supreme Court decision involving Cornell University has broken down some of the kind of ambiguities or barriers that enterprising plaintiffs' attorneys might have found in addressing these lawsuits. And so there's the potential for there to be wider opportunity to go after plans of smaller sizes, organizations of smaller sizes, because of the removal of some of these barriers. And so given that backdrop, and with Halloween right around the corner, we want to talk a little bit about some of the fiduciary risks that are scaring executives that we talk to, and ways that we can help you protect and prepare yourself in the event that you find yourself subject to some of these discussions. So the 4 primary areas where we're going to spend some time together this morning are talking about fees, plan forfeitures, managed accounts, and in-plan income or in-plan guaranteed options available in retirement plans. So I'm going to start by talking about fees. This has been the primary area of litigation going back to, I think it was 2008 when the 408B2 regulation was passed. This was the retirement-focused regulation that started requiring transparency related to how retirement plan fees are paid. And once everybody was made aware of how fees were being paid, it made it far easier for plaintiffs' attorneys to identify plans that might not be meeting their fiduciary obligation to ensure fees are reasonable. And so this is a pretty significant area of litigation. As you can see, over $1 billion just in settlements across 500 cases that have been filed over the past decade or so. Now, typically, the issue in these cases is that plan sponsors are not fulfilling their fiduciary obligations to ensure fees are reasonable and to avoid prohibited transactions. The fees that we're talking about here apply to a couple of different areas in your retirement plan. So there are fees associated with the investment options that your participants can choose within your investment menu. It's going to apply to record keeping costs. So the record keeper is the organization that runs the website, sends the statements, keeps John's money separate from Sally's, etc. And administrative service providers, making sure that your plan is operating consistent with the terms in your plan document. So we're going to start by talking about record keeping fees. As I mentioned, record keepers is the organization that runs a website, sends out the statements, etc. And there are two primary ways that record keepers are paid for those services, either on a fixed dollar structure or an asset-based structure. And so you can see on your screen here examples of how those two different fee structures would impact the expenses that participants are paying. With a fixed dollar or per head fee structure, every participant pays the exact same dollar amount regardless of their account balance. So you can see here, 3 different people, 3 different account balances. It doesn't matter, they're all paying the same dollar amount for the services they get from the record keeper. With an asset-based fee structure, the amount paid by participants varies based on their account balance. And so in this case, a 25 basis point record keeper asset-based fee would cost $80 to a participant with $32,000, cost $120 for somebody with a little more money. Now, either of these structures has been, deemed appropriate or reasonable by the Department of Labor, but we're going to talk more about how you, as a plan sponsor, might determine which is more suitable for your population. And that brings me to our second poll question. Again, not a test here, but soliciting feedback from you as plan sponsors. So we are curious, for your 401k plan, are you paying your record keeper using a fixed dollar or a per head fee? Are you paying based on plan assets, so using basis points based on the amount of assets each participant has in their account? Or are you unsure about the current structure that's being used to pay for record keeping services? So we'll give a couple of minutes or maybe a minute or so for feedback there. All right, interested to see if folks are paying per head or asset-based. So we've got a reasonable mix between fixed dollar and asset-based fees, but about half of you are unsure. And I will tell you that the Department of Labor does not typically accept ignorance as a defense. And so we'll want to make sure as an action item for those of you on the call who answered, I don't know, that is a takeaway. Let's find out how folks are being paid, because part of your duty is to act exclusively in the best interest of your participants, and understanding how fees are being paid and making sure those are reasonable falls under that umbrella. And so as I mentioned before, neither asset-based or fixed dollar fees are inherently better. Really, the specific facts and circumstances of your plan and your business would determine which may be more suitable for your specific participant population. And so we've captured an example here. This is a client of mine, and you can see on the top line of this chart what the total plan assets in their 401k plan, how that's evolved over the past 6 years. So when we were first hired in 2019, total plan assets were about 65 million, and they had a total of about 860 employees that were participating in the plan. Over the next 5 years, plan assets have grown to almost 175 million, while their employee or participant count has grown to about 1450. And so you can see pretty quickly the assets in this plan have grown much faster than the participant population has grown. This employer has a very generous employer contribution. They've got very high participation, And overall, the market was relatively strong over that time period, 2022 being kind of a tough one. And obviously, we had a dip in 2020, but overall, market performance was solid, which resulted in asset growth. And so in this particular scenario, this plan was paying record-keeping fees as an asset-based fee structure. And so you can see the average fee paid by participants when we had 860 people across $65 million was $76. But because assets grew meaningfully faster than participant count, that average record-keeping fee per participant in 2024 had grown to $121. And so this is an example of when we work to consult with a client, helping them think about what is kind of the likely future for their plan asset and participant count. If you think that headcount is going to grow much faster than the dollars, you may be better off with an asset-based fee because that will diminish the future cost for your participants. Conversely, in an example such as this, if assets are going to grow, but your population is likely to be relatively stagnant, you're probably going to be more economically beneficial if you use a fixed dollar fee. The second component of fees that we're going to talk about relates to the investments available in your plan. So each investment that's available to your participants comes with an expense ratio. So this is the cost that participants would see associated with investing in that particular fund. So if you go to the prospectus or Yahoo Finance or something, you would see XYZ mutual fund has an expense ratio of 1% or 0.6%, something like that. That expense ratio is made up of multiple components, as you see in the pie chart on the left. A portion of that expense ratio goes to pay the investment manager. This is the firm that's actually buying and selling the stocks and bonds that make up that particular investment. So they've got to get paid for their research and execution, et cetera. But there are other components of that total expense ratio that pay for services outside of investment management. Those are called 12B1s, sub-TAs, and shareholder servicing fees. I won't bore you with the details of what each of those components were originally intended to serve, but today we kind of lump them together and use the term revenue sharing. Revenue sharing means a portion of the expense ratio that is shared by the investment manager with other service providers. And so to try to illustrate the impact that revenue sharing has, I've included another chart here looking at a client's investment menu again. And so you can see assets by fund, the percentage of assets, the name, et cetera. But I've highlighted 3 rows here. And let's, for purpose of this discussion, assume that each of those rows represents one employee because they've got about the same amount of money. So Jake, Jim, and Kathleen, we are all 3 participants in this plan. Jake, me, has chosen to invest my money in the T. Rowe Price Value Fund. That fund costs 57 basis points, as you can see in the 4th column from the right. It says expense ratio. Jim has invested his money in T. Rowe Price New Horizons, and Kathleen has chosen to invest in Fidelity Contra Fund. So you can see the total expense ratios there. Jake is, it costs 57 basis points for me to invest in T. Rowe Price Value. Jim's paying 79 basis points in T. Rowe New Horizons, and Kathleen's being charged 39 basis points for Fidelity Contra Fund. The column next to that indicates the amount of that total expense ratio attributable to revenue sharing. And as you can see, none of the 57 basis points I'm paying to invest in T. Rowe Price Value is shared back to any other service providers. Of the 79 basis points Jim is paying, 15 is shared back to their record keeper. And Kathleen, of the 39 that she's paying, 25 goes back to their record keeper. And so in a circumstance where revenue sharing is being used to pay for a record keeper's services, I'm essentially getting a free ride thanks to Kathleen subsidizing me. I'm paying 0 to the record keeping, where Kathleen's paying about $3,000. And since Kathleen's my boss, I'm sure that is wildly disappointing for her. So this is not inherently a problem. Revenue sharing is allowable for use to pay record keeping fees. But in our opinion, this is inequitable. Kathleen and I are getting the same website, the same 1-800 number, the same statements in the mail, and it doesn't seem entirely fair that she is paying the freight for me to have access to the retirement plan. And so there is a way to solve for that inequity, and we call that fee levelization. This is applying certain structures to the way fees are paid to ensure that different participants aren't paying more or less based exclusively on which investments that they choose within your plan. There's a couple of ways to implement fee levelization. The first is to only use investments that don't have any revenue sharing component. So we would call that a zero revenue sharing arrangement. You could also choose to rebate the revenue sharing component directly back to the participants who are invested in the funds that generated it. The last is to apply both debits and credits. So for example, if we had a 15 basis point record keeping fee and my fund was generating 25 basis points of revenue sharing, I might receive 10 basis points back as a credit. Or if I was in a 0 basis point revenue sharing fund, I would get a 15 basis point credit towards my, or debit towards my account. And so you're going up and down based on the amount of revenue sharing that's attributable to the investments that you're in. Now, if I haven't yet confused you, here's my latest opportunity to do so. Any investment that's available in your plan can be offered in various share classes. A share class is the number and letter combination that you might find at the end of a name of a mutual fund. In this case, we're showing 6 different versions of the same fund, R1, R2, R3. So within each of those share classes, the underlying basket of stocks or bonds is exactly the same. There is no difference in what the investor is receiving as far as their investment allocation. The difference is based on the total expense ratio and the portion of that that's attributable to revenue sharing. And so as you look at the different share classes available of this particular fund, you can see pretty quickly that the R6 share class has the lowest expense ratio. And that might lead you to say, cheaper is better. I should be using the R6 share class for my participants because it is the lowest available expense ratio of these different share classes. However, if you scroll down a little bit to the R3 share class, what you'll see is although the top line expense is 84 basis points, 55 basis points of that 84 is attributable to revenue sharing. And if we're applying one of the fee levelization techniques we talked about before, therefore rebating that revenue sharing back to the participants who are invested in that fund, their net investment cost is actually 29 basis points because they paid 84 but got 55 back. 29 is clearly lower than 41. And as was mentioned earlier today, one of the requirements of fiduciaries is to act as a prudent expert would. So even though this math is kind of funky and it's difficult to explain to a participant, there's no doubt that a prudent expert would prefer the lower net investment cost version of that fund because we know fees directly erode performance. So this is something that we really want to help clients evaluate and identify, making sure that they're using the lowest net cost investment. So I've tried to capture for you here the real economic impact of evaluating share classes and choosing the most efficient version. This was another client of mine, and as you can see, they had assets across a variety of different vintages and target date funds. When we were hired, they were using the K6 share class of this particular investment because it had the lowest total expense ratio. You can see that on the top row there. So from 40 to 49 basis points, that appeared to be the lowest cost. However, when we evaluated other share classes of this same investment, the K and retail share classes, you can see at the very bottom, even though the retail shares appear to be more expensive on the surface, ranging from 53 to 75 basis points, because they included a revenue sharing component of 35 basis points and were able to rebate that back to participants, the net expense ratio that those participants experienced was the lowest using the retail share class. In this particular case, changing from K6 to retail and subsequently rebating that excess revenue back to participants resulted in savings of about $50,000. So this is an example of kind of some of the work that that clients are expected to do with our support in evaluating the share classes available to their participants and utilizing that lowest net cost. The last piece of the puzzle here, as was already talked about before, is documenting. That really the process that you go through to evaluate and make these decisions is going to be your protection as a fiduciary in the event that the DOL shows up or you find yourself subject to a fee-related fiduciary breach lawsuit. And so documenting that you've gone through the process of evaluating various share classes that might be available and selecting the lowest net cost version for your participants is going to offer you the best protection. So I will pause there and quickly check over into the chat to see if there are questions I can answer about my section before I hand it over, excuse me, to Jim. So a couple of questions that I see in here. One was who pays the rebate? And so in the cases we're talking about, the mutual fund company collects the total expense ratio and then rebates that portion back to your record keeper. The decision at that point is whether the record keeper keeps it to offset their stated record keeping fees, or you instruct them to rebate it back to participants. Ultimately, record keepers don't care how they get paid. They're going to have a revenue target based on the services being provided, and whether that is paid as a corporate line item expense, a per head or asset-based fee to participants, or paid through revenue sharing, they're going to get their money either way. And so in a circumstance where you're rebating that revenue sharing, that's an instruction that you as the plan sponsor provide to your record keeper and say, we want you to rebate revenue sharing generated by our investments directly back to the participants who are using those investments. Second question was what happens to the revenue expense if it's not rebated? I think I just addressed this, but if you don't give it back to your participants, then it is being used to offset plan expenses in some way. And while using revenue sharing to pay for plan expenses is allowable, it does create a scenario where it may be either more difficult to determine what total plan costs are, and therefore it can be hard as a fiduciary to validate that fees are reasonable for services provided, or you might end up in a scenario where it's inequitable and different funds with different amounts of revenue sharing are offsetting different amounts of your plan's total record keeping costs. And we think that there's a better way to do that. So I think those are the questions that I've seen here. Let me open up the chat and see if I missed something. Oh, Leah asked me a long time ago to go full screen with my presentation, and I missed that. Hopefully this has not been like 0-point font, so I will try to blow that up when I hand this over to Jim. So Jim, I will let you take it away and start talking us through the next area of fiduciary litigation.
Perfect. Thanks, Jake. Yeah, so our next section here, I'm going to spend, I've got 5 or 6 slides, maybe 10 minutes tops, and really talk about the state of litigation around forfeiture accounts. And just to set the table a little bit before we get into the slides, since the fall of 2023, plaintiffs have filed more than 60 class action lawsuits alleging the misuse or of 401k forfeiture accounts. And really, it revolves around the allegations around really using the forfeiture assets to offset employer contributions versus paying plan expenses. I tell you what, let's hop into the poll question. I'll pick back up where I left off, but real quick, do you use forfeitures to offset employer contributions? Third poll question of the day. Okay. Yes, no, we don't have forfeitures. I'm not sure. We'll see what the results here show.
When we come back with this answer, it might be helpful just to remind attendees what forfeitures are, how they're generated by a plan, to make sure everybody knows what these are and how they can be used.
Well, perfect segue, Jake. I was just going to tee it up for everybody. First, as Jake's mentioned, what is a forfeiture account, right? So forfeiture accounts are part of a retirement plan, 401k plan, is an account that holds employer contributions that employees forfeit when they leave a company before being fully vested in the employer contributions. Now, remember, your employee contributions, your own contributions to a retirement plan, are 100% vested at all times, right? But employer contributions can have what's called a vesting schedule, right? And forfeitures apply when a participant leaves or is terminated from employment, and those employer dollars they're not fully vested in yet. So just a real, quick example, I'm an employee of ABC company, right? I'm in the 401k plan. I contribute my own dollars. They're, again, vested at all times, fully vested. But the company also offers a match, and the company can, on those match dollars or profit sharing dollars, put what's called a vesting schedule on it. And let's just say ABC company offers a 5-year graded vesting schedule. It's very common, right? 20% vested a year for 5 years, you would be 100% vested. So if I leave or I'm terminated in my 3rd year of employment, I would have 60% of my account be vested. The other 40% of those assets that the employer has put in on my behalf goes into the forfeiture account, right? And that is so basically what the account is and how it works. And generally speaking, not generally speaking, long-standing guidance and best practices is essentially forfeiture accounts and forfeiture assets can be used really for 3 main reasons, right? We can offset or reduce future employee contributions into the plan. They can be used to pay reasonable plan expenses, right? Or they can be reallocated amongst participants. Those are the main reasons why. And really what's going on in terms of the litigation is a lot of the activity right now, as I mentioned, 60 class action lawsuits in the last, year and a half or so are really arguing that if forfeiture assets are being used to fund future employee contributions, that perhaps that's not in the best interests of the participant. So we're going to dive into that in a little bit, but so in forfeiture litigations, really, first of all, fiduciaries or plan sponsors must ensure that they're handling the allocation of forfeitures. In doing so, do not involve a prohibited transaction such as self-dealing, right? As we pointed out throughout the program, ERISA and fiduciary best practices is we want to do what is in the best interest of the plan participant at all times. So we need to watch out for prohibited transactions or self-dealing. Now, the legal issues really revolve around following ERISA law and following your plan documents, right? Maintaining proper documentation, taking notes, and really disclosing how you're using those forfeiture assets is going to be the key to minimizing legal exposure around the forfeitures. And then really the most common allegations, I've hit on a little bit already, but is the mismanagement of the forfeiture assets. Or is the plan provider, or is the employer plan sponsor doing what is in the best interest of the plan and the participants in the plan when they are handling the forfeiture assets? So this slide right here, as you can see, 401k forfeiture lawsuits on the rise. This year alone, in the first 8 months of 2025, there's been 35 new forfeiture lawsuits filed in 8 months, which is a sort of hot topic du jour around the retirement plan space. Now, I'm not going to hit all of these, and I've got a couple here I'm just going to read off. But as you can see, these forfeiture lawsuit motion to dismiss rulings in 2025. And as you can see, the highlighted ones, right? There's just 4 of them. You can see those motions have been denied, right? So those cases are still ongoing. But as you can see, for most of the other cases, these courts have ruled that they're either granted or granted with prejudice. So they're going through the process and finding out that the court has said, hey, you don't really have a case here. You're going to have to come back and show us further evidence that there is a breach here within the handling of the forfeitures. So some of these cases, I'm just going to read off a couple. One of the very first involved Qualcomm. We've all heard of Qualcomm, obviously. Court denied employer's motion to dismiss and found a breach of fiduciary duty and claims because they said that using forfeiture assets to reduce employer contributions may not benefit participants as much as using to offset administrative expenses. That's one case early on. Intuit is another case we've been seeing a lot about, not on this list. And actually, this is one of the earlier cases. Court allowed fiduciary breach claims related to forfeitures to move forward, although just very recently, we did see that this Intuit case was settled out of court for roughly $2 million. So that's of interest that we're starting to see some of these cases work their way through the courts. Some other ones that you see here on the list, HP, federal court dismissed claims with prejudice and emphasized plan documents permitted forfeitures use to reduce employer contributions, and that this practice is longstanding and accepted, right? JP Morgan Chase, quite a brand name that we all see in here, dismiss claims alleging misuse of forfeiture to lower employee contributions. Siemens Corp, also on the list here. Lawsuit dismissed, no breach found related to forfeiture use. Nordstrom's, we all probably very familiar with Nordstrom's. Court granted a motion to dismiss or similar claims. And last but not least, Honeywell, similar result is dismissal. So again, a lot of activity in this space right now. So really, what can you do? What can plan sponsors do in terms of forfeiture guidance? Or really, what are our best practice, right? How can you guard against this, and how can you minimize your liability as much as possible? And first and foremost, the golden rule in ERISA: adhere to plan provisions and plan documents, right? That is, retirement plans are set up. They're very complex. There's this long legal document and all these provisions that are in the plan. First and foremost, it is very imperative that plan sponsors file plan documents all times, right? Next to that, not only do we need to file plan documents, but document. I sat in a conference maybe 15, 20 years ago in Philadelphia, and a very well-known ERISA attorney spoke and basically said, at the end of the day, even though maybe the decisions that employer or plan sponsors might not be the absolute best, as long as they are documented and detailed, that in a court of law will help significantly if there ever is a lawsuit. Next, establish clear policies, right? Develop, implement written policies on how forfeiture assets should be managed, right? It's imperative to have a prudent process and to document the decisions and write these down. And then last but not least, conduct thorough reviews, right? It is never, you can never do enough review of your plans. Meet regularly, conduct a review, and make sure that you're complying with your plan documents and ERISA and IRS regulations. So in terms of forfeiture strategy, again, really more of a best practices here, strategic decision on forfeitures and expense management. Again, always want to assess the risk and legal implications, right? Consider potential legal risks and fiduciary duties when deciding how to use forfeitures. And as I said, most important of all is following your plan documents and document decisions. Next, engage fiduciaries, right? Get involved, be with the retirement committee, with the folks tasked with running the plan retirement committee at a company. Involve the fiduciaries and have discussions around how you want to treat your forfeitures, and have that documented and spelled out is always a best practice. And then ultimately align the use of your forfeiture account with your plan goals, right? We want to ensure that forfeitures are allocated in a manner that supports the plan objectives and goals. So ultimately, at the end of the day, with all the activity around the litigation around forfeiture accounts, we want to make sure that you are following plan documents and documenting decisions. In the event of a suit or legal proceeding, having those documents in place and having a prudent process and documenting those steps is ultimately going to be your best course of action in mitigating risk with forfeiture lawsuits. So.
Thank you, Jim. We'll leave the Q&A open for just a second in case folks have questions about forfeiture use and some of the preceding lawsuits here. But I think to summarize Jim's point, the lawsuits that have not been dismissed, it's largely been because even though the plan sponsor might have been using forfeitures in a way that's consistent with longstanding practice, it differed from what they had written down in their plan document or plan administration manual. And so again, ensuring that you're using forfeitures in a way that you have documented kind of a hierarchy, that is typically going to be your best protection to kind of utilize what that precedent from the IRS that's been set is. All right. I don't see any questions coming through on forfeitures, which means Jim proactively answered all of them. Great news. And so with that, we'll hand it over to Kathleen to start talking about what's going on in the world of managed accounts. Kathleen?
Yes, thank you, everyone. I'll close us out actually on two great topics. The first being managed accounts. The second being retirement income, and we'll provide an overview of where we are from an industry perspective. So just to level set, let's first talk about what is a managed account. Basically, you are leveraging technology to offer a more personalized experience, investment experience for plan participants. Typically, this is an optional feature that is introduced to a plan. It's offered inside of the 401k. It's not an investment option itself. It is a service. So it allows your participants to utilize a managed program that is managed by professionals, and it's according to a very personal profile and circumstance, which, to contrast with a target date fund, is based solely on one data point, which is simply the participant's date of birth and when they turn age 65. These services rely very heavily on technology to deliver investment experience. It's very similar to what would be obtained by working directly with a financial advisor. So it's very personalized based on income that is unique to that participant. In addition to full fiduciary or 338 discretionary management, which means that when a participant elects the service of a managed account, they are turning over their account to the professional manager to manage for them. So that means that manager makes decisions on a discretionary basis. There also may be additional benefits that are available for those participants that do not elect to use the service, which are enhanced educational tools and personalized point-in-time advice. Those two items typically are not additional fee for service, whereas turning over the management of your account to the managed account service provider would be an additional fee for the participant. Before we move on to the next slide, I did want to just give the audience an update from a litigation standpoint. According to the Fiduciary Decisions ERISA litigation database, there have been 17 plan committees that have been sued regarding the managed account option in their plan. Of those 17, some have settled with no admission of guilt. For example, the R.R. Donnelly settlement for $1.2 million in January of 2024, and others have had their cases dismissed at the pleading stage. So there is still a lot up in the air on this topic. As a reminder, however, the decision to add a managed account service to a 401k plan is indeed a fiduciary decision. So plan fiduciaries have a responsibility to evaluate and monitor the managed account provider, ensuring that the service is provided to a level of fiduciary standard. This includes considering the quality of the services, the value delivered to participants, and the fees charged. Proper due diligence and ongoing oversight is essential to make sure that any decision does align with the best interest of plan participants. All right, next slide. We have another poll question. Does your plan offer managed accounts today? We'll give that just a minute. Yes, no, or I don't know, and we'll move on quickly because I know we are closing in on time. So we had about a split on that from a poll question standpoint around yes and no, which actually coming up here, we'll look at some statistics on usage. But as a reminder, today there is a range of professional options that are typically available. When we started with retirement plans, it was the very simple, plain vanilla balance fund. Stocks, bonds, maybe some cash, but it was static. It did not change, did not evolve, did not de-risk. Now we've seen target date funds introduced, which have, of course, become incredibly popular and dominate the retirement landscape. But managed accounts, as I said earlier, the biggest difference is the personalization. It takes into consideration not only age, which is what target date funds do, but also balance, salary, other assets, male, female, location, many other considerations. The most important thing here is the personalization, and the more that a participant goes in to add additional personal information and goals and objectives, the better the outcome will be. As far as looking at just popularity, it is something that we see almost half of plans offering. So that quick flash poll that we did was very indicative of the marketplace. As you can see here, It is definitely favored by very large plans, giving those participants the option to elect that service as a plan feature or benefit. All right, next slide. Key benefits, again, looking at the benefits beyond the management of just the investments themselves. Those free tools and personalization are typically available to everyone in the plan, meaning that every participant, regardless if they decide to elect the managed account solution and pay the additional fee, they get to benefit from additional personalization features. What is probably the most beneficial is that bottom confidence number, which is, as the chart shows, managed account users are almost 3 times as likely to say they are very confident in their retirement investment strategy as non-advice users. So it's instilling that degree of confidence in what they're doing is the right thing for them, putting them on the pathway for success to be able to retire with dignity. Next slide. There are, of course, drawbacks with managed accounts. There are costs, again, just for those participants that elect the managed account service and elect to pay that additional fee. Participant understanding. In a recent Cerulli study, less than 1 in 3 participants actually could correctly identify what a managed account was. Benchmarking for you as a plan fiduciary, the challenge in terms of ensuring that you are conducting your fiduciary duty in terms of benchmarking your managed account provider and the need for participant engagement. All right, our perspective, generally speaking, on managed accounts is that the decision to add a managed account has minimal or no setup costs, and the only participants who pay for it are those who've actually affirmatively elected it. We do see, from an industry standpoint, adoption is low. It is not uncommon to have 5% or less of plan participants adopting the managed account solution, but that is not necessarily a bad thing. You don't want participants adopting the managed account paying additional fees who are not truly committed to utilizing it to its full extent. Managed accounts as a QDIA, I do want to mention this because this is an area that we are starting to see, not just from the traditional sense of we are going to make the managed account the default investment rather than more commonly the target date fund. That does, of course, add an additional level of expense and fee that other default options like the target date fund does not incur. That is a higher threshold, and as really evidenced by the relatively low adoption of managed accounts as a default in the marketplace, would be something that we would, issue caution to ensure that there was thoughtful consideration of how that decision was determined. But at the end of the day, to put it simply, if a participant is paying a managed account provider a fee to improve retirement outcomes, that managed account provider should help participants improve their savings, investing, and spending behavior. And you as a plan fiduciary need to be able to document and determine that. And like any other fiduciary decision, again, there needs to be a process in place to select and monitor, not just that the record keeper threw it in when you converted the plan to them 10 years ago. We do follow a formalized approach to regularly benchmark existing managed accounts within 401k, as well as incorporate a formal RFI or request for information or request for proposal when a plan is considering the adoption of a managed account service. Remember, a record keeper often has more than one managed account provider. They, of course, will have their proprietary version, most likely. However, they may offer a third-party solution as well. It's up to you as a fiduciary to understand what the options are and properly vet them. On a final note on this, there is a new flavor of target date fund managed account that's been recently introduced to the marketplace, which essentially uses a target date fund as the default and then automatically transitions to a managed account at a specified age, say 50 or 55, which may significantly increase the fees to participants. So a participant would be going along until age 55 in their target date fund, and then boom, they get switched over to a managed account. Fiduciaries need to be particularly diligent in terms of evaluating those types of solutions. Also understanding who gets paid what in that type of an arrangement. Is the advisor a party to that managed account solution in terms of collecting a fee as a portion of that increased managed account fee? A lot of due diligence and documentation certainly required there. All right. I do want to just touch on this. I'm going to touch on it for about 2 minutes. There was a recent lawsuit filed. Schlichter, which was the law firm that really instigated all of the litigation, filed a suit against Empower. And essentially, next slide, it basically that Empower was sued by former and current retirement plan participants. Core allegations basically focus on fiduciary breaches, which means that Empower is accused of not acting in the best interest of plan participants. The key issues include improper handling of participant data, conflicts of interest that may have influenced decision-making in charging excessive fees on managed accounts that are rolled outside of the plan. Additionally, the lawsuit claims that Empower used deceptive sales tactics to promote these high-fee accounts. The bottom line here on the next slide is if you as a plan fiduciary also need to be aware of the oversight and activities of your record keeper. So we do have recommendations, making sure that you strengthen oversight on governance procedures, looking to get legal guidance, of course, when necessary, and prioritizing transparency. Making sure you understand exactly what happens when a participant terminates. Does your record keeper reach out to them? Are they trying to get them to roll assets over into their retail accounts, managed accounts, whatever that may be? And what does the cash flow out of the plan look like? Where's it going? All right. In our last few minutes, I'm going to jump into retirement income. What we all know is I won't ask who on this call has access to a pension. Perhaps our parents may have had access to a pension plan. But the question really is who wouldn't want access to a pension plan? And that's really where the move to retirement income has become a very, very hot topic for planned fiduciaries. What we know is we require today a participant to essentially become their own investment manager, accountant, and actuary at the point in time that they retire. How do they manage this huge responsibility of taking everything that they've accumulated throughout their lifetime and making it last until they're no longer with us? And the problem there is, of course, no one knows when that date is. So it is a very challenging thing for a participant to be able to manage. There is a retirement income life cycle. The first thing that you as a plan sponsor would need to really determine is this something that you are interested in doing? I'm sure many of you, of course, in the world of finance heard the word pension and it made your skin crawl. We're not talking about having another associated with paying out participants from a corporate perspective. What we're talking about here is how do we create guaranteed income that is not going to be a cost to you as an employer, but helps to facilitate that lifetime income need. We've heard this morning that ERISA requires that both health and welfare and retirement follow a prudent process. It's in the best interest of plan participants. It's important to note that if you did elect to add a retirement income or guaranteed income solution, that it is a settler decision. Ultimately selecting the investment option itself is fiduciary. And I'll touch on that in just a moment here. So guaranteed income, this idea of, wow, is this an important option for your employees? Would you like the idea, or have you heard from employees to say, wouldn't it be nice if I could have a paycheck for life after I retire from my employer? Really quick here, Jake, because we got not many minutes left.
Yeah, we've got the poll question up, and I think Leah is managing the allowance of participants to answer that. So we do want to make sure folks can answer it and get their CPE credits. So we'll leave that up there for just a moment.
Okay. So yes, this is a good one. Yes, no, I don't know. while we're waiting for that, I'll touch on what retirement income really is. So we're talking about ways to essentially decumulate income in retirement. There's two broad categories that we look at from a non-guaranteed perspective and a guaranteed perspective. And when we think about retirement income, there are many, many myths that are in the marketplace today. There's limited interest. Participants don't want it. There's no growth potential. There's high cost. There's increased fiduciary responsibility. There's no portability. It's terribly complex. All of those are certainly considerations that we hear, but most of them really are not accurate to what the marketplace currently has available, or secondly, what we are able to offer and understand from a participant perspective. So if we go to the next slide, Jake, and we look here at basically different trade-offs. There are different types, and we don't really have the time in the context of today's session to go into the nuances and differences, but essentially you have opportunities to give your participants income in retirement that is either non-guaranteed or guaranteed. And these solutions have really come a long way. As we look at the example that we're seeing most commonly of greatest interest is a target date fund embedded with an annuity feature. And that essentially over time creates an opportunity for the participant to accumulate in the fixed income portion of their target date fund, an annuity unit or the opportunity to annuitize at a future point in time. What is not inherent in these solutions is they're locked in and there's no liquidity. A participant is never locked in and the balance remains fully liquid. But if it's embedded in the target date fund, participants are accessing it via their employer without the need to engage a financial advisor or pay higher fees. And that is one of the biggest benefits inside the plan. And on the next slide, we are at fiduciary safe harbors. There are many fiduciary safe harbors, two of which are primarily focused on the selection process. Good information here to get back to. And we also just saw on the next slide, a DOL advisory opinion affirming the use of lifetime income as a QDIA or a default. On slide 42 or on the next slide, I think this is probably the most important consideration. Employees and employers recognize the need to act. They recognize that there's a concern about living their income, that it will negatively impact their mental health by not being able to retire. And 99% say it would be financially helpful to receive guaranteed income in retirement. That is a huge number. The biggest consideration here is for you as a plan fiduciary to go through a process to determine if it is right for you as an organization. That's a business decision. There are a lot of considerations that enter into it. There from a pure financial perspective, when we think about the impact of having employees that are not able to retire or don't think that they're able to retire, it is an off-balance sheet liability. They create higher costs. That delay is increased delayed retirements, increased workers' compensation costs, healthcare costs, disability costs. In fact, EY calculated that each year of delayed retirement is the equivalent of around $26,000 per employee. So there is a financial aspect as to why this is important for organizations, but more importantly, participants want it. They want that guarantee, and it's certainly a consideration that we are seeing for plans. Finally, wrapping up here, a few questions to ask. What does it look like? How do you make decisions? It is an iterative process. This is a very, very complex to the plan sponsor question, but there's a good process in place that can be had to determine if it is right for you as an organization and if it is right for your participants. But starting the discussion is something that we see, again, from an industry perspective. This is one of the top priorities for both employees and employers is how do I change my nest egg into a lifelong income stream?
All right. Jake, anything? Did you want to add anything?
No, I was going to hand it back to you, Grant. I know we've exhausted our welcome here, so I want to leave you just a minute.
No, you did not exhaust your welcome. It was just a tremendous thank you, Kathleen, Jim, Jake, Rick, Allie, the entire team. Really appreciate it. Really worthwhile today. Great presentation. A lot of great information in there. And Marsh, guys are always welcome at the FEF. So thank you very much. I'd also like to thank our exceptional marketing support team at Cherry Beckert, including behind the scenes, Leah Gearhart, Eunice Arias, and Aaron Riley for preparing and running today's event. Next week, we'll be joined by the Wells Fargo team, including Tim Quinlan, senior economist, who'll be presenting their economic update and Let's Get Digital, banking automation with APIs and embedded finance. Finally, I'd like to thank all of our sponsors for their support of the FEF series, and especially Marsh McLennan for their great program today. So thanks, everyone, and see you next Thursday morning. Appreciate it.